we've talked many times before about the importance of institutions and the importance of institutional trust. Let's recap before we get to the actual public healthcare reckoning we need in our country. Your society, all societies, this is not unique to America, are built on the institutions of that society. The institutions build and train generations of people. The institutions safeguard society against abuse that may come from anywhere, from inside that society or outside society. One great example of this, how it should work in a country. If, for instance, the federal government tries to cover up felonies committed by the president's son so Democrats can win an election. That's bad, okay? I got that, but every country has bad, evil people. Every country's going to have bad, evil leaders. It shouldn't become a mortal wound. You know why it shouldn't? Because the media, for instance, should step up and investigate and expose it and smash that kind of evil and malfeasance. If you had a media institution, that's the kind of thing they would do. Good example, right? Abortion is a great one. I'm super pro-life. But abortion's awful, isn't it? Over 60 million killed. Absolutely awful. Now, how is it that abortion has been able to go on for decades in this country and still goes on today without end? How is it? Because we should have an institution, a religious institution, that steps up universally, every denomination, and boldly cracks down on it. Says, no, this is evil, this is wrong. But we don't have that. Oh, some will. Many won't. Many will say it's okay. Many will come out. I mean, the Pope recently came out and said, well, I mean, if you do the death penalty, then you're not pro-life either. Ridiculous. Institutions. And your medical institutions are a critical part of a society. You have to have them. And the people have to trust them. You have to have some sort of a place people can go where they can rely on the medical advice given to them. And this applies to societies large and small, whether you're a big, prosperous country like ours, or even a tiny Indian tribe in the Americas in the year 1700. You need a medicine man. You need a tent where you can go to, where there's a grizzled old man who will tell you to mix this root with this kind of mud and rub it in your eyes and leave it there until you're blind, and that'll get your cold away. Reliable? I don't know, but the people have to believe it is, otherwise things go crazy. Now, our medical institutions have violated our trust over and over and over again in this country. And so much of this, if you're real young, maybe you think it was always like this. It was not. For most of my life, you trusted your doctor. If you had to go to the ER or the hospital for something, God forbid, you trusted the nurses. You trusted the healthcare institutions. How did they get like they are now? Well, like so many things, it comes back to this man.
First, no matter what you've heard, if you like your doctor or healthcare plan, you can keep it. If you don't have insurance, you'll finally be able to afford insurance. And everyone will have the security and stability that's missing today.
Yeah, Obamacare. Do you want to know why, in large part, you don't trust your doctor anymore? Why your nurse is a demon? Now, we'll get to that part in a moment. You want to know why you go to the doctor's office? Well, you know what, pause. Let me explain what it used to be like. This is for anyone who's younger. If you went to the doctor's office, let's say your back hurts. You wanted to go to the doctor's office. You would sit down in the doctor's office. Your nurse would come in. She'd check your vitals, just like today, blood pressure, all that. And then the doctor, your doctor, who knows you, he would come in and he would sit down with you. And you would sit and you would talk face to face. He'd look you in the eye. He would even discuss things that didn't involve giving prescriptions for things. Hey, your back hurts. Have you been working out? You know, you need to go for a walk, do some sit-ups, get that core strengthened. Your doc and you would sit down and have a conversation. You know what you see now when you go in the doctor's office? The back of his head, the whole time. You know why you see the back of his head? Because he's facing away from you, typing into a computer, clicking on this, clicking, and what did you say? Do you want to know why? Because Obamacare created this thing in medicine where now it's only money. It's only this checkbox and that checkbox and this insurance thing and that pharmaceutical thing. It became completely impersonal. You're just dollars and cents. Oh, you came in, your toe was sore? Here's 25 prescriptions. Come back and see me next week. We'll get you a refill. That's what it became. And of course, it filtered all the way down into the medical institutions that are now fully captured by the communists and training legions of future communists to look after you in your bed while you're laying there sick. I can't wait to be treated like these students from Columbia.
I promise to self-reflect diligently, to confront unconscious prejudices, and to develop the skills, knowledge, and character necessary to engender an inclusive, equitable field of medicine. Let us bow our heads in recognition of the gravity of this oath. We swear to faithfully engage with these ideals and obligations for the ongoing betterment of medicine and humanity.
That's where we're at. And we didn't realize fully where we're at until COVID came. We thought we still had medical institutions we could trust. And then we saw things like this.
You really should, in an indoor setting, a congregate setting, be wearing masks. It's just the appropriate thing to do to protect yourself and your family.
Our data from the CDC today suggests, that vaccinated people do not carry the virus, don't get sick.
If we really do our part, stay at home, social distance, then we can flatten our curve even below those projections. But it really depends on all of us.
I'm making the personal sacrifices not to infect my parents and my pregnant daughter. I worry about that because then it gives people the option to say, well, if bars and restaurants are open, then I can have 20 people over for Thanksgiving. And so I don't like it to be any number. I like it to be, keep it to your immediate household.
Lie after lie after lie. Remember the closure of your kid's school? Remember the footprints in the grocery store? Remember the local family-owned restaurant that had been there for 40 years that closed its doors and never opened again? Remember, it was all based on the concept of social distancing.
Here's what I want you and America to know. Those projections are definitely sobering, but they don't have to be our reality. If we really do our part, stay at home, social distance, then we can flatten our curve even below those projections.
Social distancing is absolutely critical. And if you can't social distance and you're outside, you must wear a mask.
Other than wearing masks, washing hands, avoiding crowds, and social distancing, what more on a policy level do we in the United States need to be doing?
Well, what we've got to do is make what you just said, Jake, uniform, not spotty. Everybody's got to do it. There's no excuse not to do that right now because we know that can turn things around.
So why did that local mom and pop restaurant close? Why did your child miss graduation? Why did business after business go under? The idea of social distancing. So that, of course, begs the question, where did the medical professionals we're supposed to trust get that idea?
The initial recommendation that the CDC brought to the White House, and I talk about this, was 10 feet. And a political appointee in the White House said, we can't recommend 10 feet. Nobody can measure 10 feet. It's inoperable. Society will shut down. So the compromise was around
evil. We have to get that trust back, especially in our medical institutions. It's too important. I would thank you for coming to my YouTube channel, but I know how brilliant it is, and I know you love it here. So subscribe and watch. We're going to start really ramping things up and putting some funny stuff, some interesting stuff out there, some collaborations. Either way, my YouTube channel is officially the place to be. So stick around.